Welcome to the Life Beat podcast, a One Joshua Group production, providing access to information and experts to improve quality of life and health outcomes.
So thank you for joining us. I'm Kermit Payne, your host for Life Beat, and we are very excited today to welcome our guest, Dr. Cherae Farmer. And Dr. Farmer is the distinguished Dean of the School of Dentistry at Meharry Medical College. She's also a veteran, and she served as Lieutenant Colonel in the United States Army Reserve. Dr. Farmer is a trailblazer, as the first African-American chair-elect of the American Dental Education Association. She earned her doctorate of dental surgery from the Meharry Medical College and also the Master of Science in Public Health. Dr. Farmer has also received her Master of Business Administration from the Tennessee State University. Dr. Farmer, thank you for joining us.
Thank you so much for having me. It's an honor for me to be here with you today.
We certainly appreciate your being here. We are going to have a much needed conversation in the next few minutes about the importance of oral health, particularly in populations that may be underserved and under-resourced. We're going to talk about what your suggestions are to engage personally on improving our oral health outcomes, and also policies, community engagement, and then to talk about ways that we can encourage, influence, and share with generations to come the importance, and most of all, the need for people to enter into the dental field as a career. So when we start with your area of expertise, tell us why there is such a disparity in oral health, particularly for minority and underserved communities.
That really happens. That's a loaded question, but there's so many different things that contribute to that. We talk about access to care and individuals not having access to care, needing care, but not having access to it. We talk about areas of dental deserts, meaning that within a 50 or sometimes, unfortunately, within a 100-mile radius, persons cannot find a dentist. That either one, there's not a dentist in the area, or two, they have dental insurance, but they can't find a provider that will accept their insurance. There are cultural barriers and beliefs. Some people associate dental care with pain and think that they're only supposed to go to the dentist if something is hurting. The beliefs that, well, my grandparents lost their teeth, my parents lost theirs, so it's just a natural progression that is supposed to happen. The affordability of care as well, and being able to afford it, and political impacts and some of the policies that go along with healthcare do not include, for example, with the healthcare expansion, may not include dental. And so individuals don't have coverage, or Medicare and automatically not having coverage for adults. And so people not being able to afford care.
So that helps us understand, I think, why there are differences in populations based on socioeconomics, race, ethnicity, access, geography. You talked about that, 50 miles or so for people to be able to get to a dentist. We've not talked about the impact of oral health, healthcare, economic stability, and particularly as it regards COVID in a while. COVID didn't go away. I mean, we had 5 years that we had to live with COVID. What did we see on how COVID impacted oral health seeking behavior?
I think the plus, COVID was very unfortunate, and it is very unfortunate because it impacted us in so many different ways. But I think that when we think about the plus of it is that it brought to the forefront public health and public looking at healthcare as a public health
Mm-hmm.
situation, and including oral health. Something as simple as people were not able to go to the dentist, and
Mm-hmm.
dental was not seen as an essential need during, at the early onset of the pandemic. So dental offices shut down. Um, and so trying to figure out, as we all were trying to figure out, how do we navigate through this? That was again a part of
Mm-hmm.
what do we do? And so it was important to just educate people, as we were talking about isolation and being, keeping distance, even if you were in your home, and
Mm-hmm.
little things like toothbrushes. And a lot of times you see the cup with the different prongs where everyone can keep their individual toothbrush. But having that there, and you're touching. And so we're talking about being able to spread germs,
Mm-hmm.
that
Right.
happening, or explaining to a person, okay, you've got COVID, so you don't need to use the same toothbrush. As you
Right.
come out of that, you need to change your
Mm-hmm.
toothbrush. And just like you're distancing yourself, distance your toothbrush. We
Mm-hmm.
know that stress increased during that time. And so what we saw was an increase in cracked teeth, because subconsciously or consciously, people were grinding and clenching their teeth more. And so dentists were seeing a lot more of the wearing down of teeth from grinding, or cracked tooth syndrome, as we call,
Mm-hmm.
as a result of that. Um, and so it was, again, how do we educate the people on what they should be doing to protect
Mm-hmm.
themselves, and how do we um, navigate, because the only things that we're able to provide it were what we called urgent and emergent
Mm-hmm.
care. So unless you were in severe pain, you're holding off any of the preventive things until
Mm-hmm.
after we kind of navigated through this. And from a dental perspective, it was because when you're getting dental work done, you have the aerosols, and it's something you don't necessarily think about when we talk about wearing the mask, and wearing a shield, which is kind of normal protocol as a part of providing care. But then it became important to put in other systems to help
Mm-hmm.
mitigate the aerosols, and create even greater protective barriers for the
Mm-hmm.
dentist and the dental team, to help keep them safe as they were trying to provide care.
Mm-hmm.
Yeah.
One other, you mentioned pain. Excuse me. And I know that that's why so many people don't go to the dentist, because they've had a painful experience, but they were in pain when they went to the dentist. So they were going to have pain. But just as a reminder, and help us with this, Dr. Farmer, the dentist 10 years ago, 15 years ago, from a technological perspective, is not the same kind of dental care. Can you talk to what technology has done for us to reduce the amount of pain and to make it a more pleasant experience, like Netflix on the ceiling and those kind of technological advances?
I think dentistry has come so far. If I think about what I experienced going through dental school, and what my practice was like, and I think about what the practice is like now. As you said, it's not unusual to go to an office, and just from the chairs being massage chairs to help the patient relax, and being
Relax.
able to look as you're laying back, you're able to look at the ceiling, and watch your favorite movie, or favorite show, or listening to music, to try and create, as we call, a dental salon, if you
Mm-hmm.
would, uh, that helps create less anxiety, eliminate some of the anxiety for the patient. But then 20 years ago, if you needed to get a crown, or some people may call it a cap, but if you
Mm-hmm.
wanted to get a crown, and you had to go in, and they would have to take an impression and put material in your mouth to be able to do that, and it would go off to the lab. Now technology is that you don't necessarily have to get all of the impression material, or sometimes the patients will say, the gook in my mouth.
Right.
With technology, you can use an intraoral camera or wand that can scan the
Mm,
tooth and create the model that is needed, and then digitally create a crown. And so, many offices will do in-office crowns that are created digitally, electronically.
mhm,
So technology has allowed um, a lot of advances that, I think we still have the dental labs, but the work of technology in
mhm,
helping to get a denture in a day or partial in a
mhm,
day, or um, fillings that,
mhm,
years ago, it was only the silver or the amalgam fillings. Then we went to tooth colored composite fillings. And so being able to create the more natural look in the patients, technology has allowed to do that. And
mhm,
you think about if you go to the dentist and they're telling you they've taken x-rays. And so used to be they would tell you, well, you've got cavity here, cavity there, and you may or may not understand. And now the with artificial intelligence and technology, being able to show you, to have a camera where you're looking at a monitor and the camera is going around in your mouth, so you're able to see what the
mhm,
dentist is able to see and have a better understanding, and to
mhm,
see visually what they're talking about, or to be able to see when they are talking about you've got bone loss, and being able
mhm,
to actually look on a monitor and say, this is my mouth, and you seeing what they're explaining to you
mhm,
about bone loss or calculus, or even um, healthy gums and healthy
mhm.
teeth. So technology has really helped us connect more with the patient.
Mhm.
As we think about, cars have advanced, televisions have advanced, dentistry has advanced as well to keep up with our
Mhm.
society, and as the society is advancing.
Mhm.
And so we think about the cell phone, and when it first started, it was the size of a telephone book, and now
Right.
you can hold it in your hand. And so dentistry is no different in being able to do that.
So I think the dental industry has been very wise from a marketing perspective, and you mentioned it, that it's no longer a dental office; it is a dental salon. So that helps prevent, at least reduce, some of the anxiety about going to the dentist, and you feel like you are there for something other than pain. It
Mhm.
gives you a chance to relax before that, and so the pre-visit is also important. You have people who call you and, say, this is Kermit Payne. I'm calling from Dr. Farmer's office. Want to make sure you're okay. Not to just to
Yes.
remind you about your visit tomorrow, but to let you know that we care about you. So,
Yes,
those kinds of personal touches make a big difference in our dental
absolutely.
care. I want to tell you right now that my dentist, who just retired, she'd been my dentist for 21 years, was received her dental training from Meharry Medical College, and my oral
Fantastic.
surgeon also received his dental training from Meharry Medical College. Both of my oral surgeons. So shout out to Meharry on that. And I haven't been going to them for 21 years just because they went to Meharry, but because they got excellent training. And I just want to make sure that's not a plug; it's fact, as we would say.
Thank
So, what do you believe um, has has contributed more significantly to people seeking better health care? Why do you think there's an increase in people changing their oral health seeking behavior?
I think there has been an improvement, but are we there yet? No.
Mhm,
Because if we were there yet, we would not have still health disparities and
mhm,
certain populations that, in certain communities, that would have high prevalence of disease, uh, as I mentioned earlier, not having access to care.
mhm,
So I think that um, advances in programming to make sure, the chip program and making sure that
mhm,
children have coverage has
mhm,
helped. Um, there's a big conversation and discussion about fluoridation, and science and data is the evidence that supports the importance and the positive impact that fluoridated water has had on reducing caries. And so
Mhm.
those types of things have helped to improve oral health. But
Mhm.
how do we, and I'll even say programs like loan repayment programs, whether it's through the National Health Service Corps, to encourage uh, healthcare providers to go into rural and underserved areas to improve access, have helped to move the needle. But there is still a level of a shortage of healthcare
Mhm.
professionals. Now,
Mhm.
studies have also shown that when we talk about better outcomes, when people have the choice and they can see people who look like them and go to people who look like them that are from the same culture, the same community, there are better outcomes. And so when we talk about the percentage of people of color uh, in the United States, and specifically if we talk about blacks make up 13 to 14% of the U.S. population, we only make up about 3.7% of the entire dental population. And I will give a little plug here. Of those current practicing dentists in the U.S. today, approximately 27% of those Black dentists that are currently practicing are Meharry graduates. And so that is something that we are proud of. But we need more dentists. We need more dentists who will specifically serve underserved
Mhm.
areas and underserved people and in underserved communities. And so there is still work to be done. And
Mhm.
we cannot grow weary, but continue
Mhm.
to acknowledge that, recognize that, and
Mhm.
appreciate that there's still work to be doing to
Mhm.
increase the number of healthcare professionals, and specifically those that will go into those communities.
Mhm. It's interesting. My new dentist um, went to graduate school and got an MPH, and her being in public health caused her to understand that she wanted to be a dentist. So
Mhm.
she went from getting an MPH to going to dental school because she
Okay.
thought that that was an opportunity for her to improve public health was through
Yes.
dentistry. You talked about um, dental disease and
Mhm.
dental well-being as well. Do you think that people are aware of the impact of poor dental disease on other diseases? Can you talk about the relationship of good and bad oral health and to systemic disease
Sure.
care?
I think that the plus of oral health is that now it is being associated with, say, cardiovascular disease, diabetes, Alzheimer's. And so being able to make that association from a medical component and understanding that, um, I don't think that you know people realize that as recent as last week, and one of the organizations that I'm a part of, the Links Incorporated, and we were planning a webinar and just talking about the association of what happens with oral health and menopause, what happens with
Mhm.
Alzheimer's, and just not understanding that what happens in the mouth can affect the other parts of the body. And
Mhm.
so it's a wonderful opportunity that healthcare professionals collectively are able to um, associate that, if you've got dental disease going on in your mouth, um, the bacteria that is in there can get in the bloodstream. When you
Mhm.
finally say it, you're like, well, that makes sense. If it gets in the bloodstream, every part of our body has blood, and it has the potential to go to other areas, and it can cause problems and can impact. And so I think it's important. And while as dentists we have said that, but to have the other healthcare professionals now, and again, studies and
Mhm.
data, the evidence demonstrates that when you have cardiovascular disease and you have oral disease in your mouth, infections going on in your mouth, plaque and calculus built up, that can impact
Mhm.
cardiovascular disease. It can
Mhm.
impact diabetes. That's why when we
Mm-hmm.
say if you're diabetic, you normally we say you need to have your teeth cleaned every six months. But for a diabetic patient, it may be more often than that. The healing process, if you're having an extraction or some major dental work done, may be longer because you're diabetic, or
Mm-hmm.
things of it's now being associated with Alzheimer's. So
Mm-hmm.
there is the association, and we say all of the time the head is connected to the body. What happens in the mouth can affect the rest of the body, but
Mm-hmm.
being able to demonstrate that and
Mm-hmm.
stressing the importance of when you're talking to for a physician to be talking to a patient about their heart health and those things, but also being able to stress, do you have a dentist, do you have a dental
Mm-hmm.
home, when was the last time you had your teeth cleaned? And
Mm-hmm.
so even in my educator hat, educating uh, the medical community on these are basic questions that need to be a part of the what we call the medical history.
Mm-hmm.
You can have 4 to 5 basic questions. Do you have a dental home? When was the last time you went to the dentist? When was the last time you had your teeth cleaned? Are your teeth sensitive when you drink hot or cold?
Mm-hmm.
Um, are they sensitive when you eat sweets? Those questions are basic questions that will give significant information about just from do you have a dental home? If you haven't been in over a year, you need to go and see a dentist.
Mhm. Well, we certainly thank you for re-emphasizing that the head and the rest of the body are connected.
Mhm.
So with the relationship of cardiovascular disease, heart disease, diabetes, blood pressure, all of those things are connected, both as your medical provider and as your dental provider, so that
Mhm.
we have a healthcare home. So one day we're going to stop saying medical home and dental home, and we're going to say say healthcare home, so they really look at coordinated care. That's a real challenge because then also I think, Dr. Farmer, that we'll get dentists and doctors talking together, so we really can have coordinated care and overall care. My dentist and my doctor are going around now about my blood pressure medication. So, my dentist says no and my doctor says, oh, yes. So just to
Mhm.
try to find out what that means, but just to know that, and you shared with us
Mhm.
that it is also important. The patient also has a responsibility
Yes,
to be engaged and to own their own care and to take
exactly.
advantage of the resources to know that. And I think you looked at my questions because you had already started talking about our next point, and you mentioned the work that the Links is doing. So my
Mhm.
question is about community interventions that work, and I was going to ask you about examples of that. So you gave us one,
Mhm.
and what she's saying, and she's a member of the Links as well as being a member of Alpha Kappa Alpha sorority. So I just thought I'd give
Absolutely.
those plugs for her. So are there other community interventions you think that help us address our oral health uh, needs?
Oh, absolutely. We say there's power in numbers. It's so
Mm-hmm.
community organizations, churches. I know of very few churches that don't have some level of community outreach. So being able to, and we know that in the Black community, the church is still considered that trusted source
Mm-hmm.
in the community, and so being able to, it's not a who's on top um,
Mm-hmm.
type mindset, but who are we together collectively working
Mm-hmm.
on the common goal? And that can include the churches, the community organizations, the Links Incorporated, uh, not just Alpha Kappa Alpha Sorority Incorporated, but all of the Divine Nine
Mm-hmm.
organizations, the boys and girls clubs, um, companies and organizations like AARP that has health initiatives, the March of Dimes that has health initiatives, the American Heart Association. And when we think about what is the goal, and that is better health for all
Mm-hmm.
of these organizations working together collectively to move the needle and to engage in the community and meeting people where they are. So
Are.
that is going into the community and
Mm-hmm.
collectively working with the organizations. For
Mm-hmm.
some, working with the church, you're not going to reach certain parts of the
Mm-hmm.
community. but working with your Divine Nine, you may be able to reach those. Or
Mhm.
working with AARP, you may be able to reach some of your older adults, and working with assisted living facilities and community health centers and HBCUs. Collaboration, because it is
Mhm.
not just about improving the health of others, but you got to have people that are going to be the healthcare providers.
Mhm.
And so creating that pipeline, working with your local schools, your community colleges, your universities, so that you're educating and encouraging the next generation to think
Mhm.
about healthcare as a career, and not just talking to them about it, but helping them to navigate that process. What does that look like? And
Mhm.
even with the community, and we're talking with people of, as you mentioned, taking control of your health. What are some of the questions that you need to ask? How do you advocate? How are you your own advocate for your
Mhm.
health? And not being afraid to ask questions. In this world of Google and being able to Google things, we I'll say in a minute, there is not the Google doctor. Google is not the doctor, but you can get basic information so that you can ask questions about your health and
Mhm.
your diet, and being an advocate in your community. It's easy for us to say, well, you need to change your diet and you need to eat healthy foods. But if you're in a food desert and you don't
Mhm.
have that, and so with us working collectively, we can meet the needs of the community so that we can have healthcare
Mhm.
improvement for all.
Now, I have a two-part question.
Mm.
So, Dr. Farmer, in a general medical practice, we had lots of virtual visits. So, tell me about virtual dentistry. How does that work?
So just like we have what we call telehealth or telemedicine,
Right.
teledentistry is here, and it's continuing to progress. And as the
Mhm.
smartphone is advancing, that is allowing teledentistry to continue to advance as well. But that allows you, for example, for the dentist to do wellness checks and
Mhm.
to do consultations to talk about some of the questions that I asked,
Mhm.
to be able to see, are you having any pain? What is that pain like? Um, and what are some of the other things that you have going on? Because sometimes you may think that it's a toothache, and it may be a sinus infection that
Mhm.
you have going on. So it allows you to connect with the patient, to do check-ins, post-operative work, to be able to check in with the patient. But technology again is allowing us
Mhm.
to be able to, when you do that teledentistry, being able to see what's going on in the patient's mouth, and being able to look and say, uh, no, you can't treat it over the phone, but you can help navigate the patients, so that then they can have appointments and schedule. You can
Mhm.
navigate what is critical and urgent, and we need to take care of it, or this is something that is just an aphthous ulcer that can be treated with warm salt and water or peroxide rinses, for example.
Mhm.
Mhm.
Dr. Farmer, why did you become a dentist?
Wow. Interesting story. When I was in high school, I had the opportunity to participate in a summer program, and it was a pre health program. It was a health careers opportunity program. It was at Tougaloo College, and it was for high school students to introduce them to careers in medicine and dentistry, and got a chance to stay on a college campus. We had the opportunity to shadow different offices. So, of course, going into the program, I thought I wanted to be an OBGYN, and went and visited an office and quickly was like, nah, I don't want to do this. I went to a community health center and I shadowed a dentist there. And to see the impact of two things that were impactful. Gentleman came in very, stocky, husky guy, but was so nervous, was having to have a tooth extracted. And the comfort that the staff gave and the dentist in being able to provide that, and to take this big strong man who was just mush in the chair because he was so afraid, and to be able to calm him and convince him, and then uh, another lady that came in edentulous, and just to see the facial change of that, I mean, it made her look 10, 15 years younger when she got her dentures, and the impact. And I said then I wanted to be a dentist. So
Mhm.
fortunately, going into college, I knew what I wanted to do, and that
Mhm.
was to become a dentist. But it was being in that high school program, and having the opportunity to actually go to offices and visit different areas was what really made the difference. And that's why I'm such a proponent of
Mhm.
pipeline programs and being able to let young people put on a white coat, see
Mhm.
themselves in their future, and the potential and the possibility
Mhm.
of that. And the irony is that at Meharry, we have a health careers opportunity program
Mhm.
now. So to be able to direct a program that mentors high school and college students, uh, and that's where I got my introduction, is
Mhm.
like a full circle moment to me.
So, Dr. Cherae Farmer, the distinguished dean of the School of Medicine at Meharry Medical College,
School of
what do
Dentistry.
you of dentistry? I'm sorry. Can you please share with us what the parting words are for, I'll say young people, but anyone who's interested in going into the dental field? What would you do to encourage or at least have them think about becoming a dentist?
Well, I want to say that first, I stand on the shoulders of so many, and I have to pay homage to Dr. Jean Sinkford, who just recently passed, and she was the first woman dentist in the country. She was not
Mhm.
only a mentor but a friend, and I learned so much from her. And I think that it is important. I really want to say to young people, or to anyone, if even if you're not sure if that's what you want to do, be open to the possibility. And if you're open to the possibility, then explore that option. And you can be your best advocate for achieving what you want to do. You don't have to be the number one person in the class. Smarts is important, but you have to be dedicated and committed. And when you're dedicated and committed, then you can achieve what it is that you want to do. And I know that sounds like a cliche, but we think about any person, if any athlete that you talk to, they had to work hard. I would say
Mhm.
the same thing. I had to work hard at it. And you have to work hard at it. Anything that you want to do. If it was learning to ride a bike, you didn't just get on the bike, you had to work at doing that. And achieving your dream is something you work at. Becoming a dentist was a dream. It was something that I knew I wanted to do, but I had to work at it. So I encourage you. Dentistry has been a wonderful career and a
Mhm.
wonderful profession. It not only allowed me to fix someone's smile, but it allowed me to have an impact on someone's life, to
Mhm.
take care of people. And not just to take care of people, but as an educator, it allowed me to train the next generation, to mentor young people. As a retired lieutenant colonel, it allowed me to train soldiers. It allowed me to also provide health care to our country as soldiers were going out to protect our country. And so it allowed me to do what I had been trained to do, and that was dental care. And just as I did it, I stood on the shoulders of others. I encourage young people, and I encourage older people, and community organizations to encourage young people to be their best and to succeed, achieve, and consider dentistry as a profession. It is possible, it is doable, and give them the support that they need to be able to do that.
Well, Dr. Cherae Farmer, thank you so very much for all the work that you do and also for all the work that you do at Meharry Medical College School of Dentistry. She shared with us the importance of being dedicated, being committed, and doing your best. Thank you again for joining us. I'm Kermit Payne, your host for LifeBeat. Thank you. Be kind to yourself and be kind to others.
We would love to hear from you. Send your listener letters, questions, and topic requests to media@the1jg.com. LifeBeat, the podcast, is sponsored by One Joshua Group, your strategic source for engagement to improve life through better health, education, and information. To learn more, visit us at the1jg.com or follow our work on social media using hashtag 1JGCollabs. One Joshua Group, advancing access to healthcare and education by joining what you know with what we've learned.